Well, I was sort of living in denial. I had leg pain for about 2 years, and it would get better, and then it never was 100% better, but it was manageable to not very manageable. But I went to chiropractic. I started getting Chinese herbs, and they all helped a little. And PT, I was in PT for 8 months. And so my PT finally said, would you just go get an x-ray? And it turns out I had no cartilage on one hip and one hip joint, didn't have cartilage, and I had bone spurs. I spoke to 3 surgeons just to get second opinions, I guess third opinion. And they all said, you're not using a cane? You're not in a wheelchair? Like, they were surprised I was walking around with the mobility that I had. And that's because of the acupuncture. Our first mission in therapy was to fix the leg pain, and then once I got the x-ray and it was clear that acupuncture might not be able to do that on its own, he said, well, we're gonna get you as strong as you can be so that when you're after surgery, you're just gonna take off and you're gonna be right back there. And that's exactly what's happened. There was this really neat moment. Robert works with a PT, and we set up an appointment that both of them would work on me at the same time. And the PT is over here on this side I'm on the table. PT is trying to extend my leg because this hip flexor was so tight it didn't want to extend. So the PT's over here doing different things, massaging things, trying to get to that leg to extend. And Robert's over here and he puts a couple of needles in, and I think it's called a referral point. So this is for the hip. And so the PT's over here trying to get the leg to extend, and Robert puts the needles in, and my leg goes zoop, like it was someone else's leg. Like it was amazing. When I first started seeing it, I wasn't sleeping. It's like so many other things were messed up. Like my skin looked funny, and my diet, my digestion was weird. Just really messed up. And just the 2 months pre-surgery, so I still had the hip condition, but I was sleeping, and my digestion was good, and my skin looked better, and I was functional. And I know that I didn't make this up. And I know this was not placebo, because although I wanted help with my leg, I really wasn't sure that he was going to help. And he helped in ways that I didn't even know that was wrong. I forgot what it was like to get 8 hours of sleep. I forgot what it was like to feel comfortable after eating. I'd been in pain for so long, I'd forgotten those things. So I certainly wasn't expecting them to come back, and they did. Without an ally like Robert, you have to figure everything out. And patients can do that, but every point of view is necessary and useful, I think. It's scary to get surgery, and there's so much confusion and so many opinions that it was really great to have somebody there that was knowledgeable to really guide you.